do you say to people that are a little hesitant about getting vaccinated still?
Sure. So one of the things with this grant that we received, one of the initiatives that we are engaging in is centered on evidence-based motivational interviewing. And so with motivational interviewing, that is a proven evidence-based technique that is all about changing behaviors.
This is where we really want to focus our efforts and have an impact, because the zip code of 32304 is one of the lowest, if not the lowest, in socioeconomic statuses in the state of Florida. So right now in Tallahassee, when you think about last year at this time when we were in the throes of the COVID-19 pandemic, we were averaging 48 cases of COVID-19 per week. Currently, our hospitalization rate for COVID-19 cases is at 2. So that is a drastic change, and that is in part due to the rigorous campaigns that we have had for vaccinating our communities.
We are collaborating with a lot of the partners within the city of Tallahassee. And so what you're seeing is a lot of the vendors that we have built relationships with. You are seeing educational institutions like Florida State University School of Nursing.
So having a grant like this where we can have a community event and also have nursing students, have nurses themselves, have healthcare workers that are engaged and are able to talk with the individual and gain their trust so that they can feel confident about receiving the vaccine. That is the focus of the grant, and that's our mission with this grant.
Dr. Sampson started a nonprofit hero.
Some residents, they understood the dangerous impact that the pandemic had. A lot of the residents, they would tell us, I'm not going to get vaccinated, and it was like a stonewall approach to us.
I'm not sure we have a health care system. We have a disease care system.
We know that COVID-19 devastated black and brown communities. We know that if we don't be more aggressive and progressive and proactive, that there'll be another pandemic. One of the saddest takeaways from this pandemic we're not seeing is we weaponize and politicize vaccines and masks. So we had to work extra hard to educate people that this is not political. You know, this is about your life.
And there are some people that because of their religious belief, they believe that that source will protect them.
Jesus is not going to come down and give you a vaccine, but it works through scientists and doctors to discover and create safe vaccines. So the myth that God's going to take care of me, if you get in your car and drive 100 miles per hour down the highway and expect God to take care of you, I think you got the wrong God.
We have been in the throes of recruitment of students, recruitment of the nursing faculty and also community nurses, developing social media for the COVID-19 vaccine hesitancy, developing TikToks, in addition to developing hashtags so that we can increase the awareness of COVID-19 vaccination hesitancy, and also encouraging individuals to get their boosters, gathering the data, reviewing the data, signing the nursing students up for motivational interviewing training. Motivational interviewing is a proven technique that is allowing individuals to understand their behaviors, and it's allowing the individual to make a decision in the direction that the interviewer is hopefully going to have them to undertake, which in this case is receiving a COVID-19 vaccination.